Dr. Jeff here again today. Today we're actually going to talk about active release therapy. Active release therapy is a soft tissue technique. Actually, I was one of the first people in town to learn it. It's kind of like a massage, but it's more active. When muscles get tight, they shorten. Massage therapists will rub it, and that's done what we call statically as you lie on the table. And that helps to loosen the muscle. But to lengthen it, to give it its power back, we have to actually take the muscle, we have to pull it apart, and we have to get our thumb inside of it and release it. It can be a little sore when we do that, but the idea is to get length back in the muscles. Now you have lots of room to contract and get the power back. We have found that at our office here, somebody with a sore shoulder with a rotator cuff type of tendonitis, we can actually take that shoulder, and within one treatment we can gain about 50% of the strength back and range of motion back in the shoulder. So today we have Rachel here today. We're just going to do some active release therapy on her neck and shoulders. You'll find that when we do it, it's very active, and the idea is we're moving the patient through ranges of motion. So Rachel has a bit of a stiff neck today on the left-hand side. She slept a little funny. So I'm just going to feel around here a little bit. I'm just going to get Rachel to start here. She's going to go back and forth like this for me. Now, as you see, it's an active motion, so we're actually putting the joint and the muscle through its range of motion, trying to get in there and try and separate those fibers out a little bit. When we do that, it can be a little tender. Right, Rachel?
Yes.
A little bit. Then we're going to come here, we're going to go down. A different muscle will come down here like this, up and down for me. The other thing with active release therapy, it's also designed for dealing with nerves. Sometimes when muscles get tight, nerves will actually, when they go through the muscles, actually get stuck within the muscle fibers. And it sounds almost like pulling a thread through a needle where the thread kind of gets a little stuck. Now you're going to take this hand, you're going to go from here, you're just going to watch your hand going up and down like that for me. That's it. It's like pulling thread through a needle when sometimes the thread gets a little caught up in the needle, you can't quite get it all the way through. Same thing can happen with a nerve inside a muscle. The muscle gets really tight and we actually get in there, we actually pull the nerve through the muscle and release the nerve. That's really good for things with sciatic pain and some carpal tunnel syndrome or thoracic outlet down the arm. That's it, good. And one more. And now we're just going to go up and down like this for me. So again, we can do this on pretty well any type of muscle or any type of joint that moves. That's really tight.
Mm-hmm. Yeah, that's what hurts the most.
And a lot of times when you're in, I'll be doing this on a patient. I'll do 2 or 3 spots of ART before I actually get in and do an adjustment so I can loosen the joint up to make the adjustment a lot more effective. Great. So if you think you're a candidate for ART, or if you have more information on ART or active release therapy, you can send me an email or come to the office and have a chat. If you like this video, share it with people. Have a great weekend.